YouTube family, how you guys doing today? It's your boy Big Smooth back again with another video presentation. Remember to like, comment, subscribe to my channel as I post videos in the future. Excuse me of my coughing. I have sarcoidosis in my lungs, so if I cough throughout the video, I do apologize. I wanted to talk about the medical industry, about far as again, the medical industry is making a lot of money and stuff like that off our insurance. Since me being on dialysis and since me doing treatments and stuff like that or whatever, I kind of was doing a little bit more research about how these companies out here are pretty much milking our insurance. And I'm not trying to come on here to throw shade and nothing like that or whatever, but it's it's ridiculous. Let me explain why. Number one, pretty much when you go to the doctor, right? Whether you're sick or you get the checkups or you need some type of care, special care and stuff like that, you go to the office and then you go to the clerk or whatever. You tell them that you have an appointment, you're here to see your doctor, get checked out if you're sick or whatever again. So the thing is, you take out your ID, and number one thing that they ask for you is your insurance card. And then it all depends on what package of insurance that you pay for. You may have to come out to pay for a copay. And to me, that's ridiculous, because the amount of money that we spend on insurance a month and stuff like that or whatever, there should be no type of copays and stuff. I think copays are overrated. I think it's a money grab, and sometimes people really don't have copays like that, so that's why they go to the front desk and say, I don't have the copay right now, so you just go ahead and bill me. But sometimes when you see the specialist, they don't want to see you because they need that copay money, which is ridiculous. I mean, this is the type of world that we live in, which is called United States of America. So the thing about it is this, right? Again, me being on this dialysis, it's a big change in my life, as I stated before. Each and every time when I do my treatments and stuff like that, whatever, I'm always gonna have to make sure my insurance is straight, because it's very, very expensive. Dialysis treatments are very expensive. For example, I do my treatments at home, and I look at my claims and stuff like that for my insurance, and it's about between $13,000 to $14,000 per treatment, and I gotta do it 4 times a week, right? And I have to do it 5 times every month. That is a lot of money. And then when I go get my labs done and stuff like that, whatever, and I'm at the center and stuff, like if I go to travel with my queen, or if I just go to the center up here where I live at, to do my treatments, that's about $80,000 to $95,000 at the center. When I went to Florida a couple weeks ago, when I did treatment, when I did that video, that was $102,000 to $105,000 that they charge my insurance. That is ridiculous. I need the treatment. Also, other dialysis patients need the treatment to stay alive, because we could only go 2 or 3 weeks, and then I'm not trying to talk about dying, and then we pretty much die, because there'll be a amount of fluids and amount of toxins built up in the body, and there's still we don't have no working kidneys. It pretty much builds up in your body, and you can't get rid of it because your kidneys are failed. So that's why we need to have our treatments done. That's why it's a life-changing thing. So I was down Virginia with my queen. Folks had a good time. positive vibes. It was a cookout, and then we had with the church on Sunday and stuff like that. I love my family. That's my family. I love them to death. I was talking to her uncle. He had like something wrong with his foot and stuff like that. I won't get into detail about his business, but he had a major injury with his foot, and he was telling me that that it cost him about $53,000 for to get his foot seen. Just to get seen, $53,000, YouTube family. $53,000 for to get his foot looked at. Granted, he has a job and stuff like that or whatever, and the job paid for it, and he's on short-term disability. But that's ridiculous, man. That is ridiculous. See, people, let me tell you one thing. When you're not sick and stuff like that, whatever. Take this sticker off. This sticker get on my nerves. Sorry about that, y'all. Cowboy Nation all day. Here we go. Oh man, sign CD Lamb. Anyway, what I'm trying to say. So pretty much, people, check this out. So when you are not sick, right, and you go to the doctor to get your checkups and stuff like that or whatever, it's not going to cost you the amount of money about versus, like, for example, like me being on treatments, or me, like, if you have a major injury or something like that or whatever, you got to get treatment and stuff. See, the thing about it is, some of these doctors out here are good, and some of these doctors out here are not good. Some of these doctors out here, they just prescribe you with medicine and stuff like that, because they know for a fact that in the United States of America, the food that we eat and stuff like that, it's a lot of processed food, and they know for a fact that we're going to eat it. You know what I'm saying? We need to eat the food to stay alive. Sometimes you get the mushies and stuff like that. So people that's in the medical industry, like doctors and specialists and stuff like that, they know for a fact that they can prescribe us to this kind of medicine because we live off this medicine. And that medicine can be very expensive. For example, one of the medications I take, right, it's called the phosphorus pills, right? You might know what a phosphorus means. Well, let me tell you what it means. Phosphorus means that when your kidneys fail, right? Your phosphorus goes to a certain score. Now, if you have high phosphorus, I think high, low phosphorus, something like that, or whatever, your kidneys are not going to be able to filter it because there are a lot of phosphorus in the food that we eat. For example, we eat eggs, drink milk, yogurt, ice cream, cheese, all like pretty much the dairy products have phosphorus in it. So if your kidneys are failed or whatever, they can't get the phosphorus out your body, so it pretty much builds up in your body. And then if you don't watch your phosphorus, say you're going to end up having like dark spots in your skin, you're going to have sores and stuff like that or whatever. And you're going to have some body parts coming off. I don't want to talk about that, but you know what I'm talking about. But yeah, you're going to have that coming off. And that's really a serious thing. So, being on dialysis, I have to watch my phosphorus. And I got to take pills for that, to help me out with my phosphorus level. Like I said, it's not good being on the kidney failure, but hey, man, it is what it is. So with that being said, is that the phosphorus is very important because the fact of the matter is that helps you again for not having scars and stuff like that on your body. So that if you have like high phosphorus level, if your phosphorus level is not in the normal range, it can affect you of getting a kidney and stuff because they take the phosphorus level very, very seriously. So with that being said, the cost of that medication itself is about $500 or $600, I believe. And that's very expensive, you know what I'm saying? That's very, very expensive. And if somebody insurance is not up to par, how can somebody afford something like that? I'm just using that for example. Bottom line is, YouTube family, you know what I'm saying? Medication out here is very, very expensive. You know what I'm saying? Very expensive. If you don't have the proper coverage for it, you're going to be paying an arm and a leg. But at the end of the day, when you go to the doctor and you get sick, and he or she prescribe you for that medication, they get a bonus percentage off that too. You know what I'm saying? But they're going to tell you that you need to take it because you need the medication to help you if you get something to help you get sick, or help with your sickness, or you just need like for your body. And some people out here, not all, some people out here is not willing to take care of themselves, so they just live off medication. And the doctors know that. They know that for a fact. You know what I'm saying? So it's ridiculous that the number one thing in this world is medical. Because when you go to the hospital, right, you drive into the ambulance, because a lot of people don't want to go in an ambulance, because you know why? Here in my state, riding an ambulance is about $600 to $500, it's $500, $600 just to ride in an ambulance and go to the emergency room. Just to ride in an ambulance, $500 to $600 to ride into the ambulance, YouTube family, and that's ridiculous. The amount of taxes that we pay and stuff like that or whatever, it's ridiculous. And a lot of people don't want to go to the ambulance because a lot of people don't have health coverage like that. Now I know if you go to the hospital and stuff, they will treat you and stuff, but when you go to the hospital, what's the thing they ask for you? Your identification, and guess what? Your insurance card. And if you don't have your insurance card and stuff like that or whatever, again, they will treat you, but they'll have you sign on the form to say you give us authorization to treat you. But as soon as you get off the hospital, if you don't have no proper health insurance, they're going to be sending you a bill. And that bill could be $53,000, $20,000, $40,000, $60,000. However, how long how much the bill is. And some of these doctors out here, they will keep you in the hospital for days and for days, you know what I'm saying, to milk your pockets and stuff. Because they want to sit there and tell you, well, we need to run more tests and stuff like that. Run more tests and stuff. I remember I went in the hospital one time. My hospital bill came up to $42,000. Another hospital came up to $20,000. And another hospital bill came up to $30,000. Going to the hospital is not a life, it's not an achievement. It's sickening for real. I don't like going to the hospital. You know what I'm saying? You take care of yourself, don't be like me. You know? So at the end of the day, you just have to make sure that you have your insurance. And I know for a fact that, you know, YouTube family, that you guys have families out there, and I know it can be very expensive when you pay insurance for us, like, you know, with your family and stuff like that or whatever, you know what I'm saying? And you still got to pay co-pays, even though you paid a lot of money in insurance. And the thing about it is, health insurance can go up anytime they want to. But again, YouTube family, we need health insurance. As I heard that, you know, in Canada, this is what I'm hearing, I think it's still the same, that healthcare up there in Canada is free. That's what I'm hearing. You know what I'm saying? That's what I'm pretty much hearing. Healthcare up there is pretty much free. You know what I'm saying? So, again, me being on this dialysis is I have learned a lot on how the kidney function, and definitely make sure your insurance is well taken care of. Because, prime example, you see the fistula on my arm right here. This is the fistula. It's pretty much, all right, this is where I stick my needles in for me to get treatments. This is my fistula on my arm. Again, I get this fistula checked every 6 months, right? And the cost for this to get this check is between $6,000 to $8,000 to get this check right here, to make sure the blood is flowing properly when I stick my needles, and then when I do on the machine. You're talking about $6,000 to $8,000, and that's ridiculous. And if your insurance is not right, they're going to call your phone. They're going to send you an email, or they're going to send you a bill in the mail and say you have to pay it. Because let me tell you one thing. I'm going to tell you this again, YouTube family. Once you sign that dotted line on that piece of paper, you give them permission to give you treatments and stuff. And if you don't have your insurance, they're going to come out to you, because you're going to have to owe them. And you have no choice but to pay them. They're going to keep calling. They're going to keep calling. They're going to keep calling until they get their money. Because you know why, YouTube family? I experienced that. I am still having issues. Shout out to my insurance coordinator, she's doing a good job. But right now, I am still having issues with my insurance by me being on this dialysis and doing this treatments and stuff. And I have to stay on top of this. And like I tell you guys this, and I'm gonna tell you guys again, and I'm not trying to sound like no broken record. You know what I'm saying? YouTube family, I beg you, once again, to take care of yourself. Please. You do not want to be on dialysis. I'm telling you guys, as far as like my experience. Now I know you got to do the treatments and stuff like that or whatever, and then you have to worry about your insurance. And me being on dialysis, this insurance stuff is very, very stressful. Because let me tell you one thing. You probably guys already know there's something called co-insurance, right? Co-insurance is pretty much they hand you like any type of treatments you have, like if you have like any type of big time injuries, or if you need any type of other treatments and stuff like that. Your insurance is only going to cover 80% of co-insurance. Okay, they're only going to cover 80%. You is responsible for the 20% to pay that bill, and they will come after you if you don't pay that 20%. For real. So that's why it's very important if you are some type of illness to have two insurance, because you never know. It might cost you an arm and a leg in the long run, but at the end of the day, it's going to help you out, because if you do any type of treatments and stuff like that for your health, then you're 100% covered. You know what I'm saying? So, I'm sorry. So, yes. Again, there's nothing wrong with turning up and eating food and, stuff like that. But again, YouTube family, just take care of yourself, man. This is pretty much what my channel is going to be. Spreading awareness of kidney failure. Sporting the bag. I just did a video just now about the medical expenses. Positive Vibe Vlogs. Like I said, next Wednesday. No, sorry, not next Wednesday. Next Monday, I am going to do my first interview with a dialysis patient. We could have did it this past Monday, but she has something to do. But next Wednesday, 11 a.m., I'm going to be doing the video with her, and I'm going to be uploading the video on my YouTube channel. And I have 2 more patients that I'm going to sit down and talk to. And if whoever wants to go ahead and collab with me, for us, like if you want dialysis and stuff like that, if you want to do a Zoom call or collab with me, I would love to talk to you. You know what I'm saying? And I just want to hear about your experience about your condition, for us, like how this affected life, or are you good, or are you happy, are you sad? Because I don't even have to know you, you know what I'm saying? And I can understand what you're going through, because being on dialysis, kidney patients, we have to unite. We have to come together. We got to sit there and say, dude, we can't let this disease destroy our life. We can't let the treatments destroy life. Still enjoy life the best way you can. You know what I'm saying? So again, I'm supposed to talk to a very nice young lady next Monday at 11 a.m. I'm gonna be at her, be at her crib. Her husband gonna be there as well. So we're gonna just sit back and chill, positive vibe, and just talk about how the condition affect her, how it affect the marriage, how to change her life, or So it's gonna be a very interesting conversation, and I cannot wait. I'm gonna be really excited. Like I said, I'm just trying to push the awareness of kidney failure, and don't make the same mistakes that I made, for like being on the machine that I have to depend on just to save your life. You know what I'm saying? So, yeah, that's all I wanted to say about the medical industry. Appreciate you guys tuning in. I'm gonna start uploading more videos on my YouTube channel. I'm gonna try to, you know what I'm saying? If I have like any topics I want to talk about, I'm gonna definitely go upload on my YouTube channel to let you guys know. So yeah, Right now, I may do another video about Verizon Fios. That's pretty much the service about, internet and TV and stuff like that. They came out with some brand new equipment, new boxes and stuff like that. As a matter of fact, I am going to do the video of Verizon Fios. Excuse me. So look out for that video today. YouTube family, once again, like, subscribe, and comment on my channel. Share my videos to your lovely families, your loved ones. Again, subscribe to my channel, put my channel out there. I'm just trying to come on here and just help people out and say, take care of yourself. I don't want nobody to be on dialysis, man. I don't want you guys to stick needles in your arm, because it hurts like hell. I'm not gonna hold you, it hurts. I done got used to it, but when I first started doing it, it hurt like hell. And that right there can be depression, for real. Because not only that, my nurses to tell me that they want me to start sticking in new spots for the needles. And if you stick a long needle like this in a new spot or whatever, it hurts like hell. It does. I'm not gonna harm it. It hurts. I'm used to it, but it still hurts. But yeah, though, man. Again, man, y'all like, comment, subscribe to my YouTube channel. As again, I post some new videos in the future. Take care of yourself. See y'all soon. Y'all love the star, Cowboy Nation all day. Jerry Jones, please sign CeeDee Lamb, pay him. Dak Prescott, here we go. Michael Parsons, let's go. Lion, you know what I'm saying? Yeah. Cowboy Nation all day. Squad up. Peace and blessings, guys. I love y'all. See y'all soon.